Taking a live look over Charleston on this gorgeous Tuesday. We welcome you back into Eyewitness News here at 5:30. We're going to talk about a pacemaker now, a new innovative pacemaker. It's going to help heart patients here in West Virginia. Dr. Chafik Assal, I want to get your title right, the Medical Director of Electrophysiology at WVU Charleston and CAMC. He joins us now to talk about what makes this different, and you're the first doctor in West Virginia to use this kind of technology. That's right?
That's right. That's right. We just yesterday implanted the first leadless pacemaker. So
wow.
Normal pacemakers are, or the classic pacemakers are ones that got implanted under the skin, under the collarbone, connect with a wire to the heart. They look like this, and this wire has been the weak link in these pacemakers. So pacemaker technology has evolved over time, and now we have the leadless pacemaker, which is very small. It's like a
wow.
multivitamin capsule almost, if you would, and this get implanted directly in the heart, in the heart muscle. So it eliminates a lot of the complications that the patients have to endure, including, the incision, the scar, the cosmetic effect, especially on ladies when, you get a pacemaker, you get the scar right here. So this is a great technology. That
so does this still go under the skin?
No, it actually goes through a tube. We put it through the leg, inside the heart itself, in the right ventricle, so in the right bottom chamber of the heart, and it has small fins at the end of it that basically connect and embeds in the muscle of the heart, and it sends electrical signal right there, and it makes the heart beat. So it's given for people with weak or slow heartbeat and make the heartbeat faster.
That's really interesting. So you did the first one yesterday. How did that go? And what, for the patient, what does that mean moving down the road, having this as opposed to the old version?
Well, number one, the patient had a very quick recovery. She was very happy with the result and went home the next day.
Wow.
They really did not have any incision, so did not have to worry about infection or bleeding or anything like that. All she had is a needle mark in her leg that is going to heal over a week. This lasts for about 12 years, so it stays in the heart for all that long, whereas prior pacemakers last anywhere between 5 to 8 years. At that time, would require battery change, which is another surgical procedure and another scar as well. So this time, you don't have even to take this out. In 12 years, the patient gets a new one that gets implanted in the same area or in the same locations.
So if someone's needing a pacemaker and they go into their doctor, how do they decide now? I know we've done one here in West Virginia. You've done the first one. How do they decide if they're going to get this pacemaker or maybe the old version? And is it something that insurance would cover? That's
a very good question. This pacemaker actually does not replace all pacemakers. Some people would need 2 or 3 wires pacemaker. So this pacemaker is only for a simple pacemaker that only has a single wire. So that would replace that kind of pacemaker. However, we're looking forward to future, directions, and hopefully soon enough we'll have a leadless pacemaker that would replace the 2-wire pacemaker soon, and hopefully it will replace a defibrillator at one time. But so far, this is only for patients who would need a single wire. And yes, insurance, Medicare has approved it. This is FDA approved. It's been FDA approved for quite a while now. And Medicare has approved it, and the private insurance, private payers had ensued. So it's the same for a regular pacemaker. So patients do not really have to worry about having to pay for this out of their pocket or anything like that.
All right, great. So new technology here in West Virginia, the first one implanted there. Dr. Assal joining us from CAMC and WVU. Thank you so much for joining us today.
Thank you very much for having me on the show. I appreciate it.
Thank you.